Well, COVID-19 cases are on the decline, but a mental health crisis is pending as this pandemic triggers a surge in anxiety and depression. According to Discovery Health, visits to mental health care workers has increased over 16%. So how do we try and help those who are struggling? How do we try and get on top of this? Clinical psychologist, there she is, Audrey Katsidzira, joining us this morning. Hello to you, Audrey. And I think 18 months ago, we all started talking about what it would look like in 18 months, 2 years, when we're all separated from family and loved ones. How would we cope? We're at that point now, and it seems a lot of us aren't coping. Why is that?
I think the difficulty really is us starting with the fact that we have an epidemic, which is a large outbreak that becomes a pandemic, which becomes this global outbreak. And I think that's something to really understand, and it's been consistent from 2019. So we're dealing with that. We're dealing with the reality of living within a pandemic. And if you consider the stats, in 2018, SADC said 1 in 5 South Africans has anxiety or depression. But what has happened from that time? What has happened from 2018? So we're looking at comorbidities. People are feeling depressed. People have anxiety. And on top of it, we already had quite a high substance use statistic.
So how do we try and help in a situation like this? Apart from speaking to a clinical psychologist like you, not everyone will have access to someone with your expertise. Perhaps it's just someone at home that we're starting to see perhaps isn't coping as well as they were. They're putting on a brave face, Audrey, and all people do, but we know them, we love them. We can see something's wrong. Just give us some advice on what we do as family and friends.
I think the first thing is really to start talking about it. I mean, we've just spoken about the stats now, and likely that's an underreported statistic that I've just mentioned. So I think we need to start educating ourselves. So conversations such as these, so exposing ourselves to information and speaking. So not being afraid to open up. So if, for example, you consider the comorbidities between anxiety and depression, you look at sleep disturbance, you look at concentration difficulties, you look at someone who's struggling to be effective at work or at school. Already those 3 symptoms occur both in depression and anxiety. That's already a starting point. Are you struggling with your sleep? I mean, are you able to sleep? And then eating, are you able to eat? And if you've got changes in your appetite, whether it's low appetite or an increased appetite, that's something to look into. So I think it's really about that, the awareness that comes from the research and the talking. So as you're saying, we're looking at loved ones. So starting to connect and open up about things that actually seem like you could, overlook it. A lot of people like saying things like, oh no, I've just never really been much of a sleeper, but are you sure? Are you sure you haven't?
This wasn't something that just suddenly exploded on the scene, though, Audrey. I'm sure you'll agree when we went into lockdown, there were people who were dealing with anxiety and depression before, and COVID-19 has exacerbated that situation for them. How do we try and help someone who is dealing with mental strain, mental issues, mental concerns before COVID, and COVID's made it even worse? I imagine in a situation like that, it's traumatizing, perhaps at a very severe level.
Absolutely. So I think, first of all, we need to think about our perceptions of mental health. We have this idea that we need to wait for a crisis. Maybe we need to stop doing that. As you're saying, there's some people that already had existing conditions. They already knew they had chronic anxiety, chronic depressions. Maybe some people are battling substance dependence, and you find that at times people then start to self-medicate. So I think it's important to monitor and to also give that tough love. Like when you see a loved one who had a pre-existing condition prior to the pandemic, when you observe them changing, which you will, because there's definitely a vulnerability, I think it's important to probe and to not be afraid, because I think sometimes we think if I give too much scrutiny, then I'm going to make my loved one uncomfortable. But I think sometimes we need to be willing to have those uncomfortable conversations. We really need to be willing to come across almost as, not having as much empathy, not having as much understanding, because our concern would be the best interest of our loved one.
Yeah, the problem is the tough love is often the tough part. But I appreciate you speaking to us. Clinical psychologist Audrey Katsidzira joining us here on eNCA, ahead of what many are suggesting is a looming mental health crisis. But just some good advice as to how we can get on top of that from Audrey. Appreciate her time this morning.